Hello, good day, everyone. Irin is Hara streaming from Oslo in a beautiful day of spring. Finally, we have some spring here in Norway. Quite unpredictable, but last 2 weeks were quite nice. A lot of sun. And for this episode of today, for the podcast Autism on 360 Degrees, I wish to share with you information and also personal thoughts around the risk factors that can contribute to the occurrence of autism. And especially, I want to pinpoint those risk factors that are mostly related with birth or pregnancy in general. Because for a very long time, and it's even normally accepted today, all these procedures that nowadays obstetrics and gynecology practice propose, and that can be traumatizing for sometimes even the mother, but mainly to the child, to the newborn, were considered somehow safe, and many women, especially for their first birth, will accept what the doctors recommend to use these procedures without knowing that many of them can be harmful, even if in appearance they are commonly accepted and considered to be okay. And as myself, as a therapist, I'm specialized in womb trauma and every type of trauma that is related to the womb, to the pregnancy. And I'm already working and worked with women in different situations. I think it is quite relevant that we speak about this, and we also show how these procedures or whatever happens around pregnancy and giving birth to a child can affect the development of the child further on, and even the occurrence of the disorders and neurodevelopmental issues in children. And I'm going to refer today again to a book that I recently bought and I'm reading, and I'm pleasantly surprised to see how much information that Dr. Melillo brings in this book is in agreement with my own thoughts and opinions around autism. I would probably speak about things that are written in the book in many other episodes. I already delivered another one, The Scientific Truth about Preventing, Diagnosing, and Treating Autism Spectrum Disorders and What Parents Can Do Now. So this doctor, he's a specialist in dealing with in everyday life as for profession with autism, and he identifies as risk factors several aspects from the environmental factors, and as I said, also the practices around pregnancy and delivery or birth. And he considered that these risks are for the prospective mother unless otherwise indicated. And I'm going to read because it's quite a big list. So one factor is when one or both parents have strong left brain skills and high intelligence. An undetected brain imbalance in one or both parents. A mother that is older than 35 and or a father 40 or older. The risk is higher for an older dad than an older mom. A mother-to-be who is overweight or obese at the time of conception and is considered to be obese at the time of giving birth. Overweight and sedentary parents. Parents who display mild autistic-like personality traits. Parents with a psychiatric history, especially the father. Maternal stress and the chronically high stress response in mother or possibly both parents. chronic inflammation in the mothers or possibly both parents, an overactive immune system in both parents, elevated hormone levels, especially testosterone during pregnancy, vitamin D deficiency, type 1 insulin-dependent diabetes in mothers or fathers, gestational or type 2 diabetes at the time of pregnancy, gluten intolerance in the mother and possibly the father, leaky gut syndrome, rheumatoid arthritis, taking drugs as thalidomide, misoprostol, valproic acids in early pregnancy and possibly before, taking antidepressant medications before and during early pregnancy, rubella, which is German measles infection in early pregnancy, getting the flu, another viral infection or a bacterial infection during pregnancy, getting fever during pregnancy, folate deficiency or a compromised ability to absorb folate, hyperemesis gravidarum, an extreme form or morning sickness, bleeding during pregnancy, traumatic birth resulting in premature birth, low birth weight, less than 5 pounds, small baby for gestational age, low Apgar score, oxygen deprivation, breech or cesarean birth, fetal distress, prolonged labor, umbilical cord complications. Another factor which surprised me is giving birth abroad, being the firstborn, a close age of siblings, a winter birth, exposure to pesticides and insecticides, sensitivity to heavy metals, exposure to road pollution, and high blood pressure. So practically in this list, we have more than 30 different kind of risks. And if I go through this list of risks, I can recognize myself as I had my child after 35 years old and his father was already more than 40. His father might have a non-diagnosed form of Asperger or another mental issue because I started to understand this after when my son started to grow up and manifest some symptoms and behaviors that to a certain extent were similar to the father. I was a little bit overweight when I conceived my child, and I was very close to diabetes, like the maternal diabetes or gestational diabetes before I went to the birth process. And the birth process was actually a C-section as the doctor recommended because my son was very big, more than 4 kilos, and it was my first birth. I was already quite old and considered somehow at risk. So, and interestingly enough, that topic of giving birth abroad, so not in your own country, not very close to the whole family. I had my mother with me, and then my father came too, but still, I was in a hospital and it's been 4 days and nights very traumatizing, together with other mothers and kids in the same room, not able to even breastfeed. So all these factors, I recognize almost half of this on this list as being my own factors, those factors that could have actually led to my son to receive a diagnosis of highly functional type of autism. And it's interesting that we often speak and put a lot of focus on diagnose and then further on how to work with the symptoms or the behaviors and how to correct what is considered not normal or healthy, or it creates difficulty and challenges for a normal life. And there is a lot of research around this and even created methods like ABA, all sorts of therapies that could somehow support and improve the life of a child with autism and also of the parents. But I never hear, or at least not so often. That's why I was really amazed to read this in this book, because this is really an eye-opener that someone, a specialist, and probably he's not alone, but I didn't hear so many others speaking in such a way that prevention and considering and mapping all the risk factors before the birth of a child and understanding how possibly these factors can influence the occurrence of the syndrome or of the neurodevelopmental issues, I didn't see so much done in this area. And this is so relevant because there is an increase in numbers. And surprisingly enough, this morning when I woke up and after that I had to check my emails, I found in the newsletters that comes from somewhere in America a very interesting notice that made me truly happy. And it was a little bit surprising because it's from one of the representatives of the Trump regimes. And yeah, I still don't know what to think about what's happening there. But this J.F. Kennedy, who is now a kind of head of the health ministry or something there. I'm not from America, so I don't know exactly how they govern everything. But he's very keen, and he's launching now worldwide international research because he wants to know why autism is so frequent nowadays, why the rate of children diagnosed with autism is on the rise, because it is an alarming, an alert, an alarm that we receive. And this news made me extremely happy. Finally, at the government level, even if it's so much contested for other measures or views and opinions, someone starts to think seriously about it and tries to understand, to go to the root cause of what is happening nowadays. And since I started to study trauma therapy and other forms of therapy and investigating also about autism, this thought about prevention and how relevant, how important prevention would be, even much more than actually doing something after when you already see that something is not okay, that something needs to be done. Prevention is something we cannot even afford to obscure or to not think about anymore. This should be the first step that any governmental policy or institutes for research should take into account. And in this prevention, only considering the huge list of risk factors or environmental factors that this author describes, and I'm pretty much 100% in agreement with him, a big portion, even not half of it, is related with the mothers. And is not saying that the mother is, or the parents in general, but the mother plays a role because the mothers carry the child in her womb and then delivers the baby, right? It brings the baby into this world. And I'm not saying this to put any blame or full responsibility on the mothers. I'm saying this because mothers, women who want to have children already had, and as me, had to experience the after diagnosis period and the confusion and not knowing what to do, because sometimes the solution is not immediate. And there are many countries where not much is done about it because there is not so much research and not so much spoken even at the institutional level in terms of action or remedy or recovery, to not speak about prevention. So mothers, women that are mothers to be, have to be very careful and inform themselves and actually map their own situation, living condition, and also the risk factors in their own environment. And everything has to start with the transgenerational trauma. You have to look behind, do a genogram, understand what kind of trauma is your lineage and the lineage of the father or the spouse of the child, the spouse or the father of the child, carry. Because those, even we don't speak a lot, those are already a background for traumatization that will create even more traumatization in the womb of the mother. And I'm going to read a little bit again about what this author says related to birth. He speaks about traumatic birth because, this is my area. I know a lot about this. I even wrote a book. You have it for purchase on Books Buy. If you want to know more, I will actually put it in the description of the episode so you can purchase it in paperback form. I wrote a book about womb trauma when I graduated from the Institute for Trauma Work in Oslo in 2022. So let's see what the author says. He says that one of the most dangerous trips we'll ever make is the journey through the birth canal. But it is a journey that is necessary to become a human and to take shape and live our life. And obstetric conditions have long been associated with a number of neurologically and neurodevelopment disorders, including mental retardation, schizophrenia, speech and language problems, internalizing problems, attention problems, social problems, and hyperactivity. And it is widely recognized in scientific literature that the birth process itself very often results in injury to the baby, especially the cervical spine. And unfortunately, a cervical injury can go unnoticed by physicians who are unfamiliar with how to diagnose and or treat it. When left untreated, a cervical injury can result in persistent developmental and functional neurologic problems as a child grows. Birth trauma that results in cervical injury can lead to a decrease in motion of the spine and cervical muscles that provide a large amount of the ongoing stimulus the brain needs to grow. And the amount of sensory input from the neck is more important for healthy brain development than the sensory input from all the areas of the body combined. An altered mobility of the neck on one side or the other can cause a significant imbalance in the sensory input to the brain from day one. Loss of or an imbalance in this input is of significant concern because it can be a primary cause of brain imbalance. Because the newborn's brain growth is primarily focused on the right side. This means it can lead to a right brain growth deficit, possibly setting a child up for autism. Many children with autism have motor problems from the day they are born, and problematic delivery could be responsible. Considering the high percentage of children who probably suffer from this type of trauma, it may actually be one of the largest causes of the higher functioning cognitive and behavioral problems we are seeing today. And numerous studies over the last few years have claimed a link between autism and specific complications at birth. And he also speaks about premature birth that can cause a variety of complications during pregnancy. And some of them are not fully explained, so probably more research will be needed. But premature birth is associated with a variety of health problems, including developmental delays and later intellectual impairments in childhood and adolescence. Low birth weight, also defined as less than 5 pounds 8 ounces, is considered a marker for putting newborns at risk for later neurological and psychiatric problems, with a laundry list of symptoms common to autism, including attention, social, and learning problems. And there is research done to this respect. There are a number of problems associated with low birth weight or being born small. Problems with the placenta can reduce blood and nutrients getting to the fetus. Maternal nutritional problems during pregnancy, as well as infection in the fetus, have been found to cause abnormal growth. Infection in the mother, diabetes, high blood pressure, and placental abnormalities are associated with growth restriction and autism. Low Apgar score. Within the first few minutes of birth, a brief neurological test is performed to assess the health of the newborn. Though named after Virginia Apgar, the doctor who invented the process in 1952, Apgar is considered an acronym for the evaluation: appearance, pulse, grimace, activity, and respiration. And the score ranges from 0 to 10, with the 7 to 10 considered normal. An Apgar score below 7 is associated with an increased risk of autism. A low Apgar score is more common in premature birth and is in generally an indicator of oxygen deprivation. Breech and cesarean births. Studies show that children with autism are twice as likely to have been born by breech birth, which are associated with increased stress to both the baby and the mother. Usually, this will also lead to a more uncomfortable delivery with more pain and anxiety. Breech birth also limits the movement of the baby in the uterus. Babies should move and turn frequently, an important aspect of brain development. There are many factors associated with having a C-section that could affect the mother and the child, including the use of anesthesia and other medications. C-sections birth also increase the stress response in the mother. Babies who do not experience the vaginal birth miss out on their first opportunity to use their primitive reflexes because they do not travel through the birth channel. Primitive reflexes allow a newborn to perform the basics of life, such as breathing and sucking. Developing and later shedding primitive reflexes is important to healthy development of motor skills. Small for gestational age. Several studies have found a significant relationship between a fetus being small for gestational age and autism. A number of factors come into play. Problems with the placenta can reduce blood flow and nutrients to the fetus. Maternal nutrition problems during pregnancy, as well as infections in the fetus, are associated with abnormal growth. Maternal infection during pregnancy, diabetes, and high blood pressure can also affect the nutritional status of the fetus and the development of the brain. The oxygen deprivation or fetal hypoxia is a serious birth complication that could have big implications for brain development. Some studies, not all, have found an increased risk for autism for these conditions that are related to oxygen deprivation, fetal distress, prolonged labor, umbilical cord complications, C-section delivery. The birth abroad. There are 3 studies conducted in Nordic countries found that a mother who gives birth in a foreign country has a significant 58% increased risk of having a child with autism. We can only speculate why this is. One of the most plausible reasons associated risk with the increased maternal stress of living in a foreign country. Another speculates that women born in another country may not be immunized against the common infections of the country in which she gives birth. And the birth order is another factor. Numerous studies have looked at factors involved in the number of pregnancies and if there is a link with autism. The consensus of opinion has found no link between miscarriage and a risk of autism in a subsequent successful birth. However, there is evidence to support these associations. In reality, from my own understanding, every miscarriage or stillbirth that a womb has for a woman, it's already a traumatizing event. And more of this happens in the womb of the woman, more the children that come after, even if they will be born, they will be affected. Of course, it is difficult to say there is a direct link, but it's one of the factors that should be considered, because until the trauma of that womb that had this loss has not been processed, higher the risk will be that something will happen with the child that is born. And for example, next to the fact that autism strikes boys more than girls by a ratio of 5 to 1, is the fact that autism is most common among firstborn than any other order of birth. The Harvard meta-analysis found that firstborns have a 61% increased risk of autism compared to being the third child or later. Risk is second highest for those born fourth or above in order. Close age of siblings is another factor, and researchers in California examined the birth records of more than 600,000 second-born children and found that children born less than 1 year apart had a threefold increased risk of autism than those who were spaced 3 years apart. And the season of conception is another risk factor. Is one of the main commonalities among children with autism. When researchers at the University of California School of Medicine analyzed data from more than 6.6 million of births, they found children conceived in December, February, and March had a 6% greater risk of developing autism than children conceived in July. And this can be related to seasonal environmental factors like wintertime flu epidemics, for instance, that can play a role. So after I brought you this information, especially if you want to become a mother, or you're already a mother, it might happen that you already have a child diagnosed with autism or with a neurodevelopmental disorder, I invite you to take a half an hour and reflect on your close environment and understand which kind of factors, based on what I provided to you as information, that are related with your womb reality, with your own story as a woman also. How, and a wife or a companion, if you are together in a relationship and you want to procreate, reflect on these factors and on the possibilities that they can influence your life in the future if your child gets a diagnosis of autism or similar. Because if you didn't conceive yet, you still have a lot of chances and methods to mitigate the risk factors that you identify. Meaning, taking care of yourself, understanding more about womb health practices, understanding more about what are the risks and complications at birth for certain procedures that are normally adopted, like the C-section or cesarean section, that actually has a high risk for many things that can happen. Inform yourself about nutrition and supplements that can support you if you are in deficit of any vitamin or minerals in your body. Inform yourself about medicines, because, for example, it can happen that sometimes infections happen during pregnancies. And if the doctor is not fully aware of what kind of medicine he prescribes, and you believe that that is the only medicine that can help you, it can also be a risk of complication or a risk factor that will manifest as autism later on in your child. Map your circumstances of life and also circumstances of the birth of your child in case you are also a foreigner in a different country. Get to know yourself to the point that you can take informed decisions and preventive measures. Because we are not yet, but I hope in the future this will happen because more people, more mothers, more women become aware of this. We are not yet at a stage where the institutionalized healthcare actually do this kind of prevention and education. Maybe some courses might be private doulas or private practitioners that support the pregnancy process and the birth process, they will start to speak about. But you should be first one to inquire and address those questions, even if they are somehow difficult sometimes. And even if you meet resistance from the professionals of the system, of the healthcare system, ask those questions. Be informed to the point that you understand what are the risks and what are the factors that can negatively impact your health and the health of your child. And yes, I will invite you to read about that book, Womb Trauma. I will place the reference where you can purchase it in the description of this episode. And trust that if you receive this information today from me and from Robert Melillo, which I really deeply thank, because it's so good for me as a professional to understand that someone thinks and speaks about it the same way I do. It feels less lonely. So, yes, think about everything that I told you today and take action. You have your own responsibility. It's just a matter of assuming it and getting educated. Inform yourself and do what is best for you and the health of your child or your future child. And if it happens that you are already a mother with a child diagnosed on autism, don't despair. There will be much more content about it, about methods for recovery. There are already other episodes available on this with people who went through this experience or people who can support you. It is time for action, but for an informed action. And I will also add a trauma-informed action and perspective, because this is something we speak about a lot, of being trauma-informed, but in reality, we can also do a lot. Beyond the information itself, we can act, recover from trauma, and support also autism recovery. Thank you again for watching this today and spread the word about this podcast. Subscribe, because I need support to grow also as a channel. So if you subscribe, you make me a favor, but you also support this project of spreading and bringing different approaches around autism on a 360 degrees approach. Thank you and have a blessed day and blessed everything.